Good afternoon. I would like to thank each and every one of you for being here with us at this live session from MAHSA University, Saujanaputra campus. Good afternoon. Dr. Katni, thank you for taking your time to conduct this webinar with MAHSA University today. We truly appreciate your assistance to help increase awareness on mental health. I am Bhavitra Krishnan, and I'm the Student Experience Coordinator and Lecturer at the Faculty of Health Sciences, MAHSA University, and I will be moderating today's session. Today's webinar, Taking Care of Mental Health, is proudly organized by the Faculty of Health Sciences, MAHSA University, in collaboration with the Befrienders Kuala Lumpur, which is an NGO providing free 24 hours emotional support service. Dear viewers, declining mental health in students is becoming a serious issue in many countries, including Malaysia. The National Health and Morbidity Survey, NHMS, they have conducted by the Ministry of Health is in 2015 revealed that prevalence of mental health problem among those 16 years and above is about 29.2%. That means 1 in 3 Malaysians have mental health issues, with highest prevalence among those aged 16 to 19 years, as well as those from low-income families. Mental health issue is linked with diverse negative consequences, such as poor academic performance, low concentration, feeling of inadequacy, and can lead to suicidal ideation in extreme situations. In light of this, MAHSA University has put in place multiple support systems to provide psychosocial support for the students who are going through emotional issues. These includes a mentor-mentee system where mentors provide personal guidance and advice to the students in relation to their academic, psychosocial, and personal concerns. MAHSA University also offers professional counseling service to students who are facing emotional distress. We have certified counselors who are available to listen to students' problems and provide guidance on coping strategies. Some students, they prefer to share their concerns and feelings with a fellow student. For them, MAHSA has implemented the buddy system. Here, trained senior students provide academic, cultural, and social support to fellow students. At the faculty level, I, as the Faculty Student Experience Coordinator, look into conducting activities that provide a conducive learning experience to the students. Besides that, I work collaboratively with the mentors to provide psychosocial support to students who are struggling with stress, anxiety, difficulties to cope with studies, family issues, and other concerns. It seems like mental health issues are still stigmatized and people are ashamed to talk about it. On top of that, university students are now struggling to cope with new norm due to COVID-19 pandemic and MCO, such as coping with the new learning styles, lack of peer interaction, financial difficulties in the family, and many other changes in their life which adversely affect their mental health. So, we believe that this webinar will give an insight to the students on mental health, when and where to seek for help, and encourage students to have open discussion on mental health. So now, it gives me an immense pleasure to introduce the speaker for today's session, Dr. Kartini Abdul Jabbar.
Hi, I'm Kartini Abdul Jabbar from Befrienders KL.
Dr. Kartini, she has been a volunteer with Befrienders Kuala Lumpur since 2016 and currently the outreach director. Befrienders is a non-profit organization that provides 24 hours emotional support to people who are lonely, in distress, in despair, and having suicidal thoughts without charge. So it will be very beneficial for students to seek for help at any time. She has significant experience in providing emotional support to those who are in distress and suicidal. Dr. Kartini is a member of the Befriender training team, helping train and supervise new volunteers. She frequently gives talks and runs workshops on topics such as active listening and suicide prevention. So now, without further ado, I welcome Dr. Kartini Abdul-Jabbar to deliver her presentation. Over to you, Dr. Kartini.
Thank you, Ms. Pavitra. Hi, I'm Dr. Kartini Abdul Jabbar, Outreach Director for Befrienders KL. Today I'll be talking to you about taking care of your mental health. So, in short, I'll be talking to you about mental health awareness and suicide prevention. So, what is mental health? The WHO in 2001 defined mental health as a state of well being in which the individual realizes his or her abilities, can cope with normal stresses of life, can work productively and fruitfully, and is able to make contribution to his or her community. So, where do the Befrienders KL come into place? We have a vision to have a world in which fewer people feel the need to end their own lives, and our mission is to alleviate stress, distress, and reduce the risk of suicide through emotional support and public education. We provide three services, which is emotional support, public education, and a support group. The Befrienders in Malaysia, there are 9 centers. Befrienders Kuala Lumpur was the first center to be established in 1970, followed by Ipoh, Penang, Melaka, Johor Bahru, Seremban, Kota Kinabalu, Muar, and Kuching. So as you can see over here, our Befrienders Center's contacts. Um, Based on the MCO, our times and services actually vary because it depends on whether we can actually go into center or whether we can provide the emotional support through phone befriending. We also have other services such as through email or WhatsApp, Skype, Facebook Messenger, or Zoom call. And our hours vary between the 9 centers. So for Befrienders Kuala Lumpur, we're open 24 hours. There are 8 telcos since 2 years ago who have committed to giving free toll to our call center. So they are Celcom, DG, Maxis, TM Time, U Mobile, WeBe, and Yes. So we're very fortunate to have these 8 telcos to commit to improving the lives of people through mental health awareness. So the mental health problems, according to the National Health and Mental Status data in 1996 and 2015, showed an increase of about 19%. This data is collected from adults aged above 16 who suffer from some form of mental illness, and they found that it was high among females, younger adults 16 to 19, singles, widows, divorcees, bumiputras, and low income. Based on the study, based on the study survey which was done in 2017 for adolescents between the ages of 13 to 17 years old, they checked that they found out that 1 in 5 were depressed, 2 in 5 were anxious, 1 in 10 was stressed, and they found that there was a mounting increase of suicidal behavior between girls and boys and from the years 2012 to 2017. So what do they think when they're having suicidal thoughts? They would usually think that they hate themselves so much that they can't look in the mirror. They wake up wishing that they had died in their sleep. They can feel a tight chest they can feel a tightness in their chest, as if someone had grabbed their heart and was holding on to it tightly. They feel as if they're going through cancer of the soul, or they're having a cancer of the soul. Sometimes might feel utter and complete hopelessness, and they might even question whether they are the only ones feeling absolutely nothing at all. Physically and psychologically, they just feel empty and numb. It's just an empty space for them. So in short, I'm just going to compare between depression and sadness because depression is one of the mental illnesses. We need to be aware that depression is not sadness, it's not part of aging, it's not weakness, it's not laziness, and it's not a character flaw. It can happen to anyone, it can happen to you or to me. It is a medical condition that can be treated and needs to be treated. And if untreated and becomes severe, it can affect quality of life and later on can also lead to suicide. Symptoms of depression can manifest through feelings, behavior, thoughts, or physically. Through feelings, it could be unusual sadness, they might feel miserable. They might have guilt or self blame, hopelessness, helplessness, emptiness, or worthlessness. In their behavior, they might have loss of interest, drive, or motivation. They might have poor concentration, they might make mistakes, have accidents. They might also have anger or aggressiveness. They would neglect their own personal care. They might have self isolation. Physically, they might lack energy. They might feel fatigued. They might have unexplained or aggravated aches and pains. Their movement or speech may be slowed. There could be changes in appetite. They might not feel like eating at all. Or changes in sleeping pattern. They might have insomnia, not being able to sleep at night. And for their thoughts, they would feel that they're a failure, that they're worthless. They might feel that everybody hates them, that it's all their fault. They might feel that they're a burden to others, or they feel that nothing good ever happens to them. Their thoughts, ultimately, they start thinking about dying and having suicidal thoughts. So how do we take care of our mental health? As I mentioned earlier, that Befrienders KL provide emotional support, public education, and suicide loss survivor support. And that our phone line is open 24/7, and this is our phone number 0376272929. And these are free calls to a 24-hour helpline based on those 8 telcos. We did a poll during the MCO period last year to find out what's the new normal. And we asked during the MCO whether the people had mental health affected. And out of the 15,000 plus votes, we found that about 50% felt that their mental health was slightly affected. So mental health is basically a mixture of cognitive, emotional, and behavioral well-being, how you think, whether you feel good about yourself or not, how you feel, and how you behave. Cognitively, if they feel negative, they might feel useless, stuck, falling sick, might lose their job. They might be questioning whether when this will this end, whether they would survive. Emotionally, they might have fear, anxiety, loneliness, helplessness, anger, aggressiveness. They might feel worried or scared or have severe mood swings. So the emotions that we asked through our Twitter account, we asked during this MCO and CMCO period, what was the most common feelings? About 36% felt fear and anxiety, 18% felt relief, about 13% felt joy, and 33% felt hopelessness. We asked whether anyone had suicidal thoughts during the MCO last year, and about 10% felt suicidal all the time. About 28% felt sometimes they felt suicidal, and the majority was about 63%, and they didn't feel suicidal at all. Changes in behavior might affect the concentration and motivation, and therefore affect performance in daily life. There could be a loss of interest, disconnection through withdrawal, or people might get into arguments and fights. There might be changes in eating and sleeping patterns and behaviors, so people will eat less and sleep less. So how do we manage our mental health? It's okay to not be okay. Just be aware and acknowledge and accept what you're going through. Most importantly, you need to stay connected to each other because no man is an island. Connect to each other either through voice, text, video, or to calls. So we asked again through our account. At that time, we had a Skype call, but now we don't have anymore because not many people knew how to use Skype. So we asked people how to connect, or how they connected to their loved ones, whether they connected to their loved ones frequently during the MCO. And almost 50% said they would connect daily. About 18% would connect occasionally. Some, like about 18% did not connect, but they were fine with it. And 17% were unable to connect and they felt lonely. So during this MCO, it's also important to make a routine for yourself apart from connecting to people. Once you have a routine, you'll be able to have a sense of normalcy and a sense of control. It it is very important that every morning you wake up and you do your normal routine. You wash, shower, comb your hair, and then after that you get on to your routine of doing the normal things that you do. If you're working during the office hours, then set your routine to work during the office hours. And after office hours, you put it aside for your own me time and for your own family time. Because a sense of routine would actually give you a sense of things haven't changed. For those who have to go through online learning, make sure that there are fixed scheduled hours for your learning. If you make it flexible at any time, you would affect the times that you eat and also affect the times that you are going to have rest or sleep. Online learning during these fixed schedules also allow interaction with colleagues or friends. Always have a morning routine, and at the end of the day, wrap up everything up so that you can actually have time for yourself and for your family. If possible, have dedicated space so that you would always know that there's one place where you can always be associating it with either school or work. And set the ground rules with people at home so that they know that during the office hours or during school hours, you are actually doing work. And if it can't be done that way, it would affect your work and your school, because what happens is that you have expectations at university. People at home need to be aware of that and respect that as well. And the most important thing is that you need to unplug from social media and being online. Right now, with the age of internet, it's very, very tempting to actually go onto the internet 24/7. But it's important to know our limits, to actually limit the number of hours we go online, because then it wouldn't affect our times when we have to eat or have to sleep or rest. And if we're going through online sources, always go through trusted sources. Because in this era of scammers and giving false information through the internet being rife, we need to be aware that we need to have trusted places where we can actually go to gain any information. How do we limit our online activities? Well, you can for this for our case, for our befrienders, you can go through this activity and then just limit it to 1 hour and set a daily reminder. So it depends on where you're always going. So you're always going through the Instagram or going through any part of the online websites, just limit yourself. And during this MCO period, it's always good to have a balanced diet, light exercise, and adequate rest. We asked again on our Twitter account what was the sleep pattern of our followers since the MCO, whether it was changed. And about 66% said it was disrupted, 15% felt it was better, and about 20% felt that there was no change. This disruption occurs if we can't control and limit ourselves when we need to be uh, doing things that we do on a normal routine. So that's why it's so important to actually have a routine every day, to sleep at a certain time every day, so that our body clock doesn't change and go haywire. So the amount of rest varies from age, varies according to age. For newborns, they would need a lot of hours of sleeping, between 14 to 17 hours. And as we age older, we need less hours, which is about 7 to 9 hours. And once the elderly, they would need about 7 to 8 hours per day. So what happens if you don't get enough sleep? Or how do you get enough or better sleep? You end up becoming cranky, and this would affect your daily routine the next day. How do we get enough sleep? How do we get the rest that we need? Practice practices which would bring us peace, such as prayers, yoga, or deep breathing, or anything sort of exercise. You can have a booklet to which basically you write every day what you're grateful for. And most importantly, always know that there is always someone out there to talk to you if you're feeling lonely. And most of all, be kind to everyone, because it's like paying it forward. One good turn deserves another. and this would spread. We need to spread the positivity. In case you're worried that you have any sort of mental distress or mental health issues, you can always go through the DAS screening tests. These are the websites for DAS 21. DAS 21 is a self-report questionnaire consisting of 21 items, 7 items per subskill for depression, anxiety, and stress. You will be asked to score every item on a scale from 0 to 3. And DAS stands for depression, anxiety, and stress skill. And always be aware that if you do have high scores, don't be afraid to talk it out and to seek professional help for it. So next up, I'll be going through the suicide prevention slides, which was requested by MAHSA College to know what the warning signs are in order to help your students. So for Befrienders KL, in 2019, we had about 36,000 contacts throughout the whole year. And these contacts are data from telephone, email, face-to-face. So that's about 99 contacts per day. Between 2019 to 2020, based on calls alone, we found that has been an increment from 2019 to 2020. It used to be about 70 to 99 calls per day about 99 calls per day in 2019. And during the MCO period, the numbers actually dropped down to about 70 calls per day. But during this current MCO, our numbers have actually gone up because the MCO has been for 2 different time periods, and it's within these 2 years during the pandemic. So our calls have gone up more than 100 calls per day, and that is just calls. We've actually cut down on our face-to-face. We can't allow face-to-face because of the MCO SOPs at this moment. And our emails have also increased, but we have not actually tabulated the differences in emails yet. So between MCO 1.0 and MCO 2.0, there has been an increment of about 54% in calls alone. For suicidal ideation, throughout the years that we have been in business, it ranges between 30 to 40%. And for calls alone, between 2019 to 2020, 2019, they had 34% suicidal ideation. And in 2020, we had 33% of suicidal ideation. It means out of 100 people who call us, about 33 people would have some sort of suicidal ideation. So these are the warning signs of suicide, which are indicators that a person may be in acute danger and may urgently need help. They might talk about wanting to die or kill oneself. They might look for a way to kill oneself. They may talk about feeling hopeless or having no purpose. They might talk about feeling trapped or being in unbearable pain. They might talk about being a burden to others. There could be misuse or abuse of alcohol or drugs. People who are acting anxious, agitated, or reckless, which they've never been before, might mean something as well. Their sleeping pattern might be affected, so they might sleep too little or too much. But most of the time that the calls that we have, they're sleeping too little and they're having insomnia. They might feel withdrawn, stay away, feel isolated. They would feel lonely because of that. They would feel that nobody understands what they're going through, that they're going through all of this all on their own. They might also show rage or talk about seeking revenge or display extreme mood swings. So what are the risk factors for suicide? These risk factors do not cause or predict a suicide. Rather, they are characteristics that make it more likely an individual will consider, attempt, or die by suicide. And basically, based on previous studies, they found that mental disorders, particularly mood disorders such as depression, schizophrenia, anxiety disorders, and certain personality disorders actually account to 24% of people who have considered, attempted, or died by suicide. Apart from that, recent job or financial loss would account about 7%. Recent loss of or relationship, whether it is bereavement or just relationship didn't work out, will also be a huge chunk. Lack of social support and sense of isolation also accounts for about 7%. Other than that, alcohol and other substance abuse or substance use disorders would also be a risk factor. The feeling of hopelessness, impulsiveness, aggressive tendencies will also be risk factors. Any history of trauma or abuse would be a risk factor. For example, if they were abused, sexually abused when they were young, these are the things which in the past happened, but it keeps on repeating throughout their whole lives. So it affects them later on in the future as well. Major physical or chronic illnesses also can be a risk factor because imagine that they have an illness which won't go away and it's constantly there. So they're stuck in that little vicious cycle and they have no way and nowhere to go to get out of that vicious cycle. Other risk factors include previous attempts of suicide or family history of suicide. And because of this, it's actually there is a general media consensus that suicide should not be glamorized and it shouldn't be reported in depth or in detail in the newspapers or in media because it would actually affect people whom we may or may not know, and they might take that as tips on how to commit suicide. So those who have actually had family history of suicide, they might have observed something which might affect how they react in future. And if they have had previous suicide attempts, the main thing is that when they even attempt the first time, they're probably just testing it out. So when people are at the very depths of their feelings, they would have gone through a lot of things to actually push them to attempt suicide. And it will only be a matter of a certain number of attempts before they would be successful. If they have easy access to lethal means, such as drugs, which can make them go to sleep and not wake up, that would also be a risk. If there are local clusters of suicide also, it would actually start off some copycat suicides. So that's why when we have K-pop idols or any celebrities who had committed suicide, we would always be aware to be that we might have increment of suicide callers during that period. Any stigma associated with asking help will also be a risk factor because these are people who actually need help and they're asking for it. If we prevent them from getting any help, they might not have anywhere to go to and they would feel that suicide is their only option. Apart from that, studies have shown that lack of healthcare, especially mental health and substance abuse treatment, will also be a risk factor for the individual to consider attempt or die by suicide. So it's important that governments work together to make sure that there's ample health care for mental health and substance abuse treatment. Other factors such as cultural and religious beliefs would also be a risk factor because there might be a belief that suicide is a noble solution to a personal dilemma. And as I said earlier on, clusters of suicide can also occur when there's exposure to others who have died by suicide, whether in real life or via the media and internet. So that's why the media actually have responsibility not to actually report in depth in any detail for all the suicides in case this would actually start off a cluster of suicides, copycat suicides. The common issues that Befrienders KL would actually get from our callers when they call us would be about 24% about mental health. Problems with relationships would be about 14%. Problems with family will be about 13%. Job issues or financial issues will be about 7%. Social issues is about 7%. But this is actually data from 2019, and we haven't yet collated the data for 2020. And during the MCO period, we had about 60 to 80 calls per day, and our suicidal ideation was about 38%. So usually the suicidal ideation would range between 30 to 40%. So I'm going to go through some facts and myths about suicide. So for this statement, people who are suicidal definitely want to die. This is actually a false statement. When we get callers calling us and they're feeling suicidal, it's because they're feeling ambivalent. They're swinging from one side to the other of the spectrum. They're not sure whether they want to go all the way through or whether they want to refrain and stop and not do it. So for our case, when we provide emotional support to all those feeling suicidal, depressed, or distressed, we actually offer this service which is helpful for those who are feeling ambivalent. People actually go through a roller coaster of emotions. Sometimes they're high and happy, and sometimes they may be very down. And during that period when they're feeling very down and lonely and they feel that nobody is actually listening to them, this is where the emotional support plays a very vital role. Those who actually attempted suicide but are eventually saved, there have been reports, anecdotes that they felt regret because at that time, if someone had just talked to them, things might have changed. And during that period when they're going through the lowest ebb of their feelings of their life, they're actually being ambivalent whether they want to go through or not. And if they actually go through it, but they're saved in the end, during those last moments before they're being saved, they actually reflect on what's going on with their life and they feel that it was actually the wrong decision. So we shouldn't have this stigma that those who actually want to commit suicide definitely want to die because we're not in their shoes. If someone tried to kill himself or herself once, there is a much smaller chance that he or she will try again. So as I mentioned earlier on, that this statement would be false because previous suicide attempts would have been a risk factor for the person to attempt suicide again. At that time, they're just experimenting whether they'd be able to go all the way through. And it's just a matter of time before they succeed. Talking about suicide openly is dangerous. It often plants the idea in a person's head. So these statements are actually wrong. Not talking about it is actually dangerous because then we're actually covering up what the person really needs, which is a call for help. There's no such thing as planting the idea in a person's head because studies have shown that talking about it actually helps the person validate the person's feelings and validate what the person is going through. By keeping it aside and ignoring this fact, we're actually ignoring the person's feelings and ignoring what the person is going through, and therefore that person ends up feeling very lonely and alone. And we're not planting any ideas by asking them by asking them openly whether they're planning to commit suicide. By asking openly, actually, we're trying to validate what they're feeling and what they're going through. Those the callers who call us, by the time they call us, usually they've already had some sort of idea of what they want to do. And even these thoughts of suicide would have already gone through by openly talking about it. We're actually checking whether they're feeling okay or not. The next statement would be suicide usually occurs out of the blue without any warning. So this statement can be false because, as I mentioned earlier on, there are risk factors and there are warning signs. It's a matter of us being trained or being mentally being aware of it, to be to know about it, that we will be able to see it beforehand. But not all the time it happens this way. Sometimes people can actually look very happy, and then the next event, they would have actually attempted a suicide or actually committed suicide. In those cases, if we were not able to see those warning signs, it's okay to not be able to do it, because every individual has the limitations in knowing what they can identify or not. But suicide prevention actually starts with recognizing warning signs and taking them seriously. So again, I'm going to go through all these warning signs so that we would be aware what they are. And if we do see anyone with any of this, we would be extra cautious and be there as a helping hand. Anyone who exhibits signs or feel hopeless or helpless, people who have any sort of mental disorder, especially mood disorders such as depression, those who start to withdraw themselves or be isolated, when there's a change in eating or sleeping patterns, they become anorexic or they don't eat or they don't sleep just as well, they're having insomnia. And when they start losing interest in their own appearance, they start becoming unkempt, stop combing their hair, stop washing. They might also be making final arrangements, such as writing out a will, or they might be expressing it. There could be absence from class or work because they already don't care what's going on. There could be a change in behavior or loss of interest. So whatever that used to make them happy would no longer make them happy. Whether there are past attempts or whether there have been abuse in substance or drug abuse or alcohol abuse. There are protective factors which are characteristics that make a person less likely to engage in suicidal behavior. So these protective factors can promote resilience and ensure connectedness with others during difficult times, thereby making suicidal behaviors less likely. So if there's effective clinical care for mental, physical, and substance abuse disorders, that would be a protective factor. When there's easy access to a variety of clinical interventions or treatment or management, when there's restricted access to highly lethal means of suicide, so this would prevent them from actually attempting. So I'm not sure if in the past you knew that paracetamol used to be in bottles. There would be like 50 tablets in one bottle. But now it has been changed to you have to actually break it off from the aluminum foil. That's actually one of the protective factors to restrict means of suicide, because then people can't pop in 50 tablets in one bottle at one shot. They would have to actually break the aluminum foil one by one. Strong connections to family and community support are also protective factors because these people would actually feel alone and they feel that they are isolated from community. So if they have family support or friends or some sort of community support, whether it is colleagues or neighbors or people within the community, they would have this connection and they would be able to reach out to others easily. That would be a protective factor. But saying that, sometimes they can be in a family surrounded by people who love them, but they still feel that they are disconnected, that they are different, that they are a burden, that they are alone, bearing all that and shouldering all that feelings and all those feelings. So in those situations, they have some sort of health problem, either mental or physical. So support through ongoing medical and mental health care relationships would be beneficial for those people. For those who have skills in problem solving, conflict resolution, and handling problems in a non-violent way, that would be a protective factor as well. And for for certain amount, cultural and religious beliefs that discourage suicide and support self-preservation is also a protective factor. So I'm just going to go through again that the Befrienders KL has a 24-hour helpline. And that's the end of my talk for today. I'll give it back to Ms. Pavitra to ask any questions.
Thank you, Dr. Katini, for the insightful presentation. Dear viewers, if you have any questions for Dr. Katini, please leave a comment and we will try to get Dr. Katini to answer them. So, doctor, there are so many people who look perfectly fine and function well with good grades, but they are actually having mental health issues. So, how can a third party like a lecturer identify if a particular student needs help?
Okay. Um, you want to identify if a particular student needs help. So I mentioned earlier on about all the signs and symptoms of those who are feeling suicidal. Some of them overlap with how they are with for people who are feeling depressed. So when there's a change in behavior, when they're no longer doing things that they like to do, when they're being withdrawn and isolated from their friends, when they start moving away, they might also lose interest in taking care of themselves. So they might look unkempt, and they might also start being absent from work or school. And this actually measures up to something that is not right. So at those times, that is the best time to actually call up the student and have a chat, ask if anything's going on.
Okay, thank you, doctor. Looks like we have questions from the audience. So the first question is from Dr. Veronica Chiu. So she said, very informative presentation by Dr. Kartini. So if we are untrained and someone reaches out to us for emotional support, how can we safely help them? There is a fear that we may make things worse by giving them advice in any direction or shut them out by asking them to consult someone qualified.
Yes. For us, basically, we do have our limits what befriending or emotional support that we can give. So, for example, if it is something that they actually need medical help for example, you feel that they are to be depressed, that it's gone beyond your scope to help and treat them, and that they need professional help, then yes, we we advise them to go for professional help and to seek medical treatment. But before we even go to that extent, what we do is that we do befriending, which is providing emotional support. And how we do it is that we talk to them, we ask what's going on, we let them express themselves, we let them talk about their issues and their problems, and we delve through each and every one. Sometimes they have gone through so many people, they've had so many solutions or advice given to them. So we don't, for us, for our charter, we don't give any advice. Um, we only can give emotional support through active listening, which means that we go through a cycle of we ask what's the problem, we clarify with them what their problems are, we go through each and every detail, we let them validate help them validate their feelings. Say they're feeling guilty about not doing something, or they're feeling sad because they've had loss or bereavement. We walk with them through all those feelings and emotions. And for us, we don't give any advice because for our charter, we believe that giving advice might be bad for the other person because we actually rob them of that ability to make decisions on their own, to think for themselves, or to stand on their own 2 feet. And it might also create some sort of dependency for them, for them to think that, oh, whenever they can't solve a problem, they would come back to us, which is not what befriending is for providing emotional support. We talk to them, we clarify, and we let them ventilate, take off the steam from whatever problems that they're going through. So that is the true essence of what befriending is and providing emotional support through active listening. It takes time and a lot of skill to actually learn how to do it, but it gets easier with a lot of practice, with having people to come to us talking through with all the problems that they have. And sometimes it's not within a 15-minute talk that it can be solved. For us, we usually it's about 30 minutes if it's something that it at least about 30 minutes if they have something to vent and to talk about. For those who are really, really highly suicidal, we can actually go into conversation with them up to 2 to 3 hours, depending on how active their suicidal ideation is. So this means that if they're ready to pull the trigger in their mouth or ready to jump off a building, we actually are with them for those 2 to 3 hours to talk to them until they've gone through that ambivalent feeling. Because I told you about ambivalence is that they're at that middle part where they're not sure whether they want to shift to the right and do it all the way, or go to the left and step back and think about what's going on. We make them talk about every issue because sometimes they feel that that particular issue is giving them so much problems. By making them go through and every step, every detail, ultimately they themselves would realize that it's not so bad, it's not that big as what they thought it was, but they need people to actually listen, and that actually takes time. So we don't give them any advice in any direction. We make them think what they want to do, but that's for befriending. I know for counselors, ultimately, you have to give them some sort of direction, um, to lead them to think of what, where they can go for further help. For us, if ultimately they need some sort of professional help, which we can provide, we do provide with other alternatives. So, for example, like an abused wife who really needs help, we do provide the number to the women's organization. We do, and if they need some sort of a mental health assessment, we do provide them with information that they can go for Mentari or through walk-in clinics for mental health. We do provide that information, but we don't advise them on what to do for their lives. We make them think what they can do for themselves rather than us giving any sort of solution. Because of that risk, the advice that we give might not be the right one, and they might end up blaming befrienders or other people who are giving them advice if things don't go right or don't go well. Because at the end of the day, we're not in their shoes and we don't know what they're going through. We can only walk with them. We don't know the real situation because there could be many facets of the problems that they're going through, and one phone call is not enough. So, yeah, that's why we make them think of their own solutions on their own. If they can do it during their phone call is good, But if they can't, our main aim is actually to give them that emotional support so that during that time period when they're feeling suicidal, they would instead choose that route of going to the left rather than going all the way to the right.
Okay, thank you, Doctor. So, Doctor, you did mention that one call is not enough to empower them. So, will the befriender do a follow up on the caller after the conversation?
Okay, we don't give any follow up because all our calls are anonymous, and they are also confidential, which means that that call is only for that time, and we can't track who calls us. In other words, we don't know who calls us, and the people who call us do not know who they're talking to.
Okay.
But we do have callers who regularly call us, and ultimately, because if you're talking to the same person quite regularly, so we would remember based on that rather than keeping tabs on it. We don't keep tabs, but it's based on the person. If they had always called the same befriender, they would ultimately remember what the issue is, and we can take on from there. But otherwise, all our calls are strictly anonymous and confidential. It doesn't go out from that call. We don't talk about it. So basically, people can feel very they can feel okay that they won't people won't know anything about them.
Doctor, looks like we have another question from the audience. So this is from Nia N. She says that she asked, apart from talking a suicidal person and encouraging him or her to go for counseling, what else can we do to prevent this?
Um, for us, basically, we do befriending, which is providing emotional support through active listening. And if they feel that they need to go for counseling or they need to go for further mental assessment or mental health treatment, they make that option to go. We don't give them the ideas or anything like that. We make them think what they need, they want. For to prevent people who are suicidal, as I mentioned earlier on, we need to know what the warning signs are, and by knowing what the warning signs are, we'll be able to detect much earlier. And I think that is much better because then you'll be able to talk to them before all of that occurs. Keep them included in the conversation in the community. Any sort of way of making exclusive little groups, little cliques, or groups by exclusivity would not be helpful because these are the people who are always the outliers, the ones who are always neglected, who end up feeling alone and lonely, and they fall off radar. So to prevent that, actually just include everyone in the conversation. Talking to suicidal people is not just what I mean is just not just talking, it's actually giving that emotional support, which means that we walk through with them what they're going through at that time and validate whatever feelings that they're going through at that time. So if they're feeling really down, we go through with them, walk with them with that experience. So that's actually very helpful for them because we've had callers who are at that verge, and by talking to them, because they're at their lowest ebb, just by talking to them actually helps.
Okay, thank you, Doctor. And some students nowadays seem to be very affected by criticism and correction. So, could you please share with us some of the ways that they should handle such situations to handle criticism and correction?
Okay. Students nowadays are affected by criticism and correction. Um, they it's because of probably how the generation has changed. For them, at the end of the day, it's best if rather than making them bend over to with all the criticism and correction, we need to be aware that the generation has changed and that this is the generation gap now. The students these days are not like in the past where they can handle tough comments. So perhaps on our side, we need to actually change the way we give those comments. There are many ways that are being taught on how you can actually give criticism or correction. One of it being the sandwich method, which means that you give a comment on what the student has done well, and then you give a comment on what the student has not done well and how they can correct it. And then after that, end it with, oh, but overall, what is their performance like? Or you can just start off with what you felt they've done well, so that to buffer whatever bad feelings they're going to have after that when they hear about all the things that they have not done well. And to comment on how they have not done well, you want to correct whatever behavior, or you want to correct whatever that you feel that needs to be corrected, whatever mistakes they were doing. It needs to be worded in a way that they understand the message without feeling that it's a personal thing. So it means that um, keep it in a language that it can be transmitted, in a message that it can be transmitted. Because no matter what we tell them, at the end of the day, we don't know what they on the other side actually hear us saying, what they comprehend when we say something. We have no guarantee. One room people where you're teaching 20 students, all of them would have different interpretations of what you have taught. So it's important to put it in a language in that is simple enough for them to understand, which is straightforward, and in a way that doing it in a kind and gentle way would actually help, rather than forcing them to bend, because this generation is not going to be able to do that.
So basically, be kind, right,
Yeah.
doctor? Yeah. So we will take questions from the audience. The next question is from Mr. Ayman. Madam, any thoughts on those people who did their mental health assessment but didn't diagnose as whatever they are testing because they didn't tick the characteristics, but they kind of feel or going through the sad, demotivated, sleepless nights life?
Usually, what we have is the other way around. People who actually do the assessment and then they had high scores and they were worried. So for those ones, we said that, oh yeah, just go and see your general practitioner or your family doctor and find out what's going on, or maybe we can direct them to the walk-in um, clinics to find out whether these assessments are actually saying something, because during that period we can't actually delve into what they're going through unless if they're willing to talk about what problems they have at that point. So for your case, you feel that they have actually done that mental health assessment, but this assessment didn't think that they fell in any of the characteristic um, illnesses, but those people still felt that they were going through a sad, demotivated, sleepless nights kind of life. So for those kind of situations, you might be having just the early phase, because, for example, to diagnose depression, you need to have low moods for at least 2 weeks. So theoretically, if the person having 7 days or 10 days or 13 days of low mood, does it mean that the person isn't having depression? Or does it mean that the person is just on their way there?
Okay, doctor. Based on your experience, can you share with us what are the common reasons behind young adults contemplating suicide, and how does providing emotional support actually helps to prevent suicidal attempts?
So previously, I mentioned that the befrienders provide emotional support through active listening, and then
Mm-hmm.
the people when they call us, they're actually ambivalent. So they're not sure whether they're going to swing to the right or to the left. So when they're calling us, actually, they want validation of their feelings and they want someone to actually listen to them rather than to give any advice or to tell them what to do because they have actually gone through all of that, being told, for given advice, being told what to do. So what we do is that we validate that, we make them talk about all their issues, all their feelings, and we walk through with them through their journey of what terrible things that they've gone through. By doing that, actually, they feel that someone is listening to them because they can be in a family or in a situation where they are surrounded by people who are there for them, but they might not, they feel that they're not being listened to, and that's why they feel alone and holding the burden on their shoulders alone. So that's how we help them, by making them know that there is someone out there to listen to them. And that's how emotional support helps prevent suicide attempts. But even so, saying that, for those, if they actually take the step of committing suicide, uh, we tell our own members that at the end of the day, everybody is an adult, that this is the choice that they made for themselves. So we cannot be accountable for another person's actions. We are all accountable for our own actions. Those people who truly require help, they feel that they're being heard, they usually step back after talking, after having all those emotions released, because it's a matter, the roller coaster at the lowest ebb, when you release all those emotions, they're gone back to the neutral state.
Thank you, Doctor. And now we will take another question from the audience. So this is by Mr. Sasi Ganesh. Is there any apps or self-monitoring tools to monitor our own mental health?
I'm not sure about the apps, but the assessment, it's found online for the DAS 21, or you can even go to the walking clinics to take the assessment. It's the depression, anxiety, and stress questionnaire. So there are 21 questions based on three aspects. Then you put a scale, you score it based on a scale of 0 to 3.
Okay, thank you, Doctor. And well, Doctor, what is your advice for us on how to maintain our mental health during this challenging time with the COVID-19 pandemic and the slowing of economy threatening our lives and our livelihood?
I think this current MCO and this pandemic, which has happened since last year, is going to be very challenging for all of us because we're not even sure when it's going to end. And even when the vaccine is around, we still have to stick to the new norm with new SOPs. So the advice to maintain your mental health, as earlier on I've mentioned, stay connected to people who are close to, people who are around you. Talk to them, connect with them, make sure you converse, have some sort of routine in your life. When you have a routine in your life, your body would be sitting through a certain kind of rhythm. So you'll be waking up early in the morning and then going to sleep at night. And then in between, you'll be doing your work. After your work, you have your me time, which is after office hours. So stick to that and you'll be totally fine because your routine, once it's changed, it would change the times when you eat, it would change the times when you sleep. And when you don't have enough food, health, nutrition, or sleep, you won't be able to function well. For the times when the economy is going to threaten lives and livelihood, I think that, at the end of the day, goes back to government, because there's only so much that we can do to control our own life. We might not be able to, when it comes to economy, it's not something that we can actually do anything much about it, accept to spend wisely and live within our means.
Okay, one last question, Doctor. Some students they might be struggling with mental health issues, but they might be afraid to ask for help due to the fear of judgment or feeling of hopelessness. So, what is your advice on those who are going through such tough situation?
Students who are struggling with mental health but afraid to ask for help because they're afraid to feel judged or they may have feelings of hopelessness, they can actually call to the befrienders because all our calls are confidential and anonymous. Or because and we also have all 9 centers, so they can call at any one of the centers. They can also get I think your university provide counselors. They can also go through all the various counselors that are available to them. They can also go to the walk-in clinics, which are Mentari clinics, which are available at different places in Klang Valley and Putrajaya. So those who are going through a tough situation, just hang in there. Um, if you feel that you need to talk to someone, there are various organizations where you can just Google up and you can get the information and you can call and get help. One of it being Befrienders Kuala Lumpur, or any of the other 8 centers for Befrienders. And if you really feel that you need to talk, you can go through your friends and everything. But at the end of the day, if you feel that you're going to be judged, then yeah, all those centers which provide anonymity would be your best bet.
Thank you, Doctor. So, for those of you who are going through some kind of emotional distress, so you can always contact the Befrienders KL. You can find their support number on the screen. And as for our students, you can find our counselor's number and also our student experience coordinator's number on the screen. So if you need help, don't struggle alone. We are here to help you. So looks like we have come to an end of the session today. Thank you so much, Dr. Kartini, for joining us today and providing such insightful information. And here, I would like to extend my gratitude to Mr. Kenny Lim, the Executive Director of Befrienders Kuala Lumpur, for his support in organizing this event. So, to our wonderful audience, thank you for joining us today. And if you wish to watch this video again, you can always watch it in our MAHSA University's Facebook page. So we look forward for your comments and participation in future events hosted by MAHSA University. So in case you have any further queries, you can always contact us through MAHSA website or visit us on social media. So please stay safe and be well physically and mentally. Have a pleasant weekend. Thank you, everyone. And thank you, Dr. Katani, once
All
again.
right. Thank you, Miss Pavitra.